Hi everyone, my name is Janelle, and for my informative speech, I am going to be discussing women's health and pap smear. Now, for women's health, it's a broad range of having mammograms, breast exams, pelvic exams, and pap smears. But the one main important thing that we're going to talk about today is pap smears. A pap smear is simply done within office. It takes less than 5 minutes and it's done by our gynecologist, and it helps us get a great reading to what your cervix lining would say if it's abnormal or normal. And anything underlying and left untreated could eventually turn into cervical cancer. So that's why I say it's the most important thing for everyone to come in once a year to see the gynecologist to have one pap smear done. Um, like I said before, if it's left untreated, it could lead to cervical cancer. I have not seen many cases where um, it's led to cervical cancer in 2 years. Cervical cancer, it takes years upon years for it to grow into your cervix and eventually develop cervical cancer. I have not seen anyone in my practice with cervical cancer under the age 35, but as we get older, obviously our immune system is not as great. So that's why it's most important for anyone over the age 21 and older to have this pap smear done. Now, let's say your pap smear is normal every year, perfectly fine, no need to worry. But if you have an abnormal pap smear, you have no worries with that. But if you have an abnormal pap smear, it's best to have um, 6 months, every 6 months screening to be able to make sure that there's nothing more abnormal than what the pap smear has said. If you have a pap smear for the first time and it comes out as normal, the next step that most providers say that it's best to have next is called a colposcopy. A colposcopy is a biopsy procedure that is also done in office, in the same office that you go to get your pap smear done. It's basically a clarification of what the pap smear has said to make sure there's nothing more abnormal that has been missed through the pap smear. It's They're basically using household items such as vinegar. Believe it or not, yes, vinegar is stained on your cervix and will be able to see any abnormal tissue that is stained and will be able to take that and biopsy it and send it to a lab. Now, pap smear results take about a week, but a colposcopy results will take about 2 to 3 weeks. Now, it is a pathology, so when I mean pathology, it's basically a minor office procedure, so they want to obviously take their time in reviewing the specimen and make sure there's nothing more than what has said in the pap smear. Now, the colposcopy, they compare what the pap smear has said, and we'll be able to know if you have any dysplasia or just mild changes in your cervical cells. When I say dysplasia, dysplasia is some grade of precancerous cells. There's 3 grades of dysplasia: grade 1, grade 2, and grade 3. Grade 3 is the worst, and as you go down, it gets better. Grade 1, if you come out with that after the colposcopy, most patients that I see, they come back in 6 months, and we'll just redo a pap smear. Now, if that pap smear comes up abnormal, they would then again have to go through a colposcopy procedure to have yet again another biopsy just to make sure there's nothing more than what the pap smear said. Anything that is grade 2 and above, there's something that we call a leak procedure that should be done next after the colposcopy to make sure we can remove completely all that tissue, because if that grade 2 and grade 3 is sitting in your cervix for a period amount of time, like I said before, it could eventually turn into cervical cancer, which is obviously any cancer is metastatic and is not good. So grade 2 to grade 3, we move on to the LEAP procedure. It's an electron procedure. They use electrical current, so you're grounded with a grounding pad. And it takes the same amount of time as the colposcopy. It takes about a half hour. An office procedure. And basically what it is, it's using electrical current to remove your abnormal tissue from your cervix, so we can basically get rid of all those abnormal margins and some normal tissue to be able to send to the lab and test for cancerous cells, and then hopefully your system will heal itself in your cervix, and all normal pink tissue will grow back to where we won't have this abnormal result with pap smears. The recovery period for a lead procedure is 2 days. I mean, you should feel some minor cramping along with the colposcopy, but other than that, it's very minor. You are instructed to come back after 3 months after a lead procedure, just to make sure everything's healing okay. And then 6 months after that, we prefer a patient to come back for a pap smear just to see what the reading may be and make sure that it is normal. Now, those are ways that we can help protect against cervical cancer after already diagnosed with abnormal cells. Now, the one thing I'm going to tell you about over the years that I've seen, there's an HPV STD, which actually causes the abnormal cells. HPV is also known as human papillomavirus. It's a sexually transmitted disease. It can be carried by males, females, girls, adults, infants. It can be carried by anyone. It can be carried. You can get it from a touch of a knob, sharing glasses, which I hope no one's doing, and you can get it by kissing someone on the cheek, and obviously sexual contact. The best way to not get involved with HPV is obviously not to have intercourse, and obviously the most preventative way to not have abnormal tissue or abnormal cells in your cervix is obviously not to have intercourse. But I'm asking for you not to do human nature, which is not possible. Intercourse is normal. But there are other ways that you can prevent having the HPV. One way is getting the Gardasil shot. A Gardasil is like best way to refer it as flu vaccine. You get a flu vaccine to help prevent the flu. So a Gardasil you help prevent to get HPV. So anyone over 16 years of age up until I would say about 34, 35 years old should get the Gardasil. It's a series of 3 shots. You get it at the first month, then 3 months later, and then 6 months later, or 4 months later, excuse me. And after those series, you hope to see your risk of getting HPV obviously degrade down to where it will be nothing. It won't completely prevent HPV, but it will better your chances of not getting it. So once you get the Gardasil, obviously you keep coming back for normal pap smears. It doesn't disregard you of not getting pap smears, saying I got the vaccine, I don't need it. No, you still need a pap smear. I can't stress enough how important women's health is to obviously us women, especially when eventually we're going to be carrying children in our future and have our childbearing ages. It is best to have a pap smear and have your yearly mammogram each year. I can't stress it enough. Over the past years, I've learned many different things about OBGYN. It is an evolving topic. And if any of you have questions regarding pap smears, colposcopies, lead procedures, or anything to do about women's health, don't hesitate to ask me. Just send me a post in discussion. I don't know as much as my providers, but I do work with them on an everyday basis, and it's something that is really intriguing, and it's a great way to learn about your own body and be able to help prevent all these certain things to make sure that for the future, our health will be obviously in good shape. Thank you for this opportunity and letting me give my informative speech. For the sources that I'm using for this speech, I'm using WebMD. Also, I use the Google search to help search about HPV and Gardasil. Again, like I said, I have most of my knowledge from my work, so I use that as a backup reference on the internet. I will post those on the discussion so you all can see where I use the site online. And then, like I said, I use my work as a site. So again, if you have any questions, don't hesitate to send me a post, and I look forward to seeing all your informative speeches. Thank you.